All right, guys, let's get started here. I think like most evenings, people sort of trickle in over the next 10 minutes. So I think it's a good time to get going and welcome everyone here. So this is probably our fifth or sixth Beyond Pain workshop, and I enjoy these nights. I like talking about this subject in particular. And the objective here is really to share information that will empower the belief that we can lead a life that's free of pain. And so we're going to look at like a naturopathic or functional medicine perspective at pain, and really the heart of the talk tonight is going to be all about excavating the root causes and the factors that exist within us or can exist within us that drive this inflammatory picture. And I also want to stay as we get started here, this information translates really well. So it applies to a host of different chronic conditions, um, metabolic disease, um, other inflammatory conditions like autoimmune conditions, um, heart disease and cardiovascular, diabetes. All of these conditions are being driven by a family of similar and overlapping chief concerns. So whether you're here with a pain story and looking for insight to support your pain, or you're here for another reason, I think and I hope that you find this information valuable. So as you read through this list, I want you to know that you're in the right spot tonight. If you've tried everything, but haven't moved the needle yet, if you feel emotionally drained with your health concern, if you're looking for a root cause approach, right? I think people that are delving into naturopathic medicine or functional medicine have that at the sort of core of their belief system. So that's certainly what I want to espouse tonight. And that if pain is somehow holding you back from doing the things that you want in your world, then yeah, this is I think this next hour is going to be valuable. And yeah, I guess in terms of timeline, I should just lay out. I'm going to do my best to rip through this in an hour. You'll notice that it is a lot of content. And there'll be times for sure that I will be going way too fast and skipping over themes and topics that require a lot more attention. But yeah, the point is right now to do sort of a brushstroke approach, present as much information as possible to highlight the breadth of all the things that can be going on and fill in the gaps later. So you're also in the right spot tonight if any of these diagnoses have been offered to you. Fibromyalgia, chronic fatigue, low back pain, hip pain, knee pain, shoulder pain, neuropathies and nerve-related conditions, degenerative disc, headaches and migraines. If any of these relate, again, I think this is going to be a valuable hour. So just to reiterate, the purpose of this workshop, and certainly the purpose of the Beyond Pain program is just to restore the belief that you can live pain-free, that it is possible, that people have done it, and you are no different from those people. So I like to start the talk by laying out sort of the scope of the problem. And I think this first graph, yeah, so this first page is not about pain specifically, but it's just to sort of set the tone in terms of the trajectory of chronic illness over the last 3 decades. So there has been an exponential spike in this following list over the last 30 years. Autism rates now the rates are 1 in every 36 kids are being diagnosed with autism. In 1990, not 3 decades ago, it was 1 in 2,500. 1 in 2,500 to 1 in 36. And as you go down the list, ADD, asthma, allergies, diabetes, obesity, depression, you can almost draw that same correlation in terms of the exponential spike between 1990 and today. And that obviously begs the question, well, what the heck has happened in the world between 1990 and 2021? And I think a lot of the information that we get into tonight will flesh that out. So in terms of osteoarthritis in particular, it is the second most prevalent chronic condition in Canadian adults. And this was I think this is a 2006, don't quote me on that stat, but the point here is it's a super prevalent chronic condition just next to hypertension in terms of Canadian adults. And I also should just point out almost half of all adults, 44% of adults over 20 have been diagnosed with one of these 10 chronic illnesses. Half of all adults, all adults have been diagnosed with one of 10 of these chronic conditions, but osteoarthritis is close to the top of the list. And to highlight the severity of the problem, this is an Ontario statistic, but 1 in 7 patients that have experienced pain have been prescribed an opioid. And obviously right now we are in the midst of a huge opioid crisis. This is a profoundly addictive medication that is needed in some cases, but has a severe downside. But 14% of Ontario's population filled an opioid prescription in 2015, 2016. We'll skip over this pretty quick, but this is just to highlight the discrepancy between females and males. Females are the red bar graph, males are the blue bar graph. So females are experiencing and reporting way more pain conditions than men are. And this is a trajectory into 2031. So the orange graph here is 2007, and then we go all the way to the red graph here, which is arthritis specifically. Arthritis projections for 10 years from now, and you can see it's just spiking off the graph. It's going to become an even larger concern over the next number of years. All right, so the heart of the talk tonight will be broken down into these 5 sections. We'll talk about my pain story super briefly, but I want to touch on that to start. We'll bring up 4 case reports, each highlighting a different root cause and showing how they sort of resolved their pain work here. We'll talk a little bit about functional medicine and naturopathic medicine and how it relates to this pain work. And then the lion's share of the information is going to be on these 6 or 7 root causes of pain. And then we'll finish off with a quick overview of the Beyond Pain program. All right, and I should say, with that Q&A there noted, we will leave some time for sure at the end, depending on how people are feeling. Some people will just want to jump off the call, but if there are some questions, leave them at any point, and I'll certainly answer what I can. But I think I'll leave them all for the end. So very quickly, very early in my life, I started to experience debilitating pain. I was dealing with arm and leg cramps at night, hot, swollen, immobile hands and knees. I had this constant sore throat as well. And I was just very, very unwell for a short period. And we were running up against a ton of obstacles in terms of finding answers. Um, we were sort of offered this diagnosis that maybe what I was experiencing was growing pains, but for a lot of different reasons, and primarily just due to the severity of what I was going through, it just didn't make sense for my family. Looking back now, know I was dealing with a form of inflammatory arthritis. It was very likely juvenile arthritis, which is an autoimmune reaction against the joints in kids. But I had my breakthrough moment when I ended up connecting with a man who became my mentor, actually, in clinical practice, George DeWitt. And he was able to identify some food intolerances and some compromised gut function, essentially, that was driving my inflammation. And so obviously this meant for me a completely different trajectory in my medical care. I became pain-free, and I avoided the fate that a lot of kids run into in my situation, which is a heavy prednisone prescription. And maybe more importantly, it set in motion a really interesting series of events in my life where I became more aware of my body and the things that were good for it and the things that were not good for it, and ultimately led me to sort of taking over DeWitt's practice and becoming a naturopathic doctor, and yeah, having this interest in supporting people in their healing work. So it's always a question, right, that I'm posing, not just to pain patients, but each intake that I connect with. It's, what is the purpose, or what do you think is the purpose of your chief concern? And for a pain situation, it sort of comes down to this: is it asking you to slow down? Is your pain asking you to feed your body differently, or to get outside more, or to heal old injuries, or to purge old toxin exposure, or look at patterns of unresolved emotional conflict? What is your pain asking? What are your symptoms more generally asking? All right, so let's jump into some case reports. We're going to look at 4, I think. So the first case report is Steve Seftel. Steve was a professional hockey player. He had a short stint in the NHL, a longer stint in the AHL. And Steve came to me in the summer of 2018 with debilitating knee and shoulder arthritis. He also was dealing sort of in a secondary concern with some panic attacks and headaches. So when Steve and I connected, it was clear that he would benefit from an elimination diet. So we got him on an elimination diet right off the bat. We got him on some adrenal support. And most importantly for Steve, we started him, or we sent him home rather, with the GI map test. This is a stool sample for infections. There was some evidence in his history that he was maybe harboring an infection. So we sent him with this GI map test. And the turning point came then in about 6 weeks later, when Steve and I connected with the results of that test, and he was diagnosed with a hookworm. So a hookworm is a super pathogenic infection or parasite that ravages the lining of the small and large bowel. He also had some H. pylori, or Helicobacter pylori, in his stomach. He had low immune function, and his microbiome was depleted. But by far the most important finding for Steve was to identify this parasite. We started him on a couple more anti-inflammatories and immune modulators, some digestive enzymes. He came back another 6 weeks, and his pain was down from a 9 to a 5. It was at that point, in that fall of 2018, that we started the hookworm treatment. So we started him on some anti-malarials, and then his progress just took off. So he went from shoulders, 9 out of 10 to shoulders 1 out of 10. He had a 80 to 90% improvement in shoulders. His headaches were gone. I should say too that his night sweats were gone. His headaches were gone, and his panic attacks rather were gone too. So he had a miraculous turnaround when we removed the parasite that was causing the inflammation that was causing his knees and his shoulders to become so inflamed. This is actually his report, and we'll skip through this because it's unnecessary, but I just wanted to show you, this is actually a microscopic picture of a hookworm on the right here.
All right.
So this guy latches on, literally like a claw, to the lining of the intestinal tract, and he just sucks you dry nutritionally. So this was the thing that was damaging the lining of the gut, that was leading to the inflammation, that was leading to Steve's pain. This is Sharon. Sharon was an osteoarthritis patient that I worked with. We connected the winter of 2017 with really bad hand osteoarthritis. Hips, knees were also affected. We started her on a nightshade diet. So we just removed all nightshades, and we started her on curcumin, a very simple early prescription. She had a huge response, a 70% improvement just in the first 6 weeks. She didn't feel hot in the joints, and her hips were no longer sore at night when she slept on her side, and she was down 5 pounds. She came back in March, just 6 weeks after that. She was down 10 pounds now, and was really impressed with where her hips were at in terms of the pain, but her hands were still a concern. And then I would say she had her breakthrough moment then, at that point, when we prescribed some adrenal support, and she came back 6 weeks after that and just felt, yeah, completely better. There was no pain in the knees and hips anymore. The hands were dramatically improved. She said about a 95% improvement overall. So Steve was a parasite. The heart of Steve's work was parasite. The heart of Sharon's work was adrenal. Nima was a patient that I saw more recently. He came in with chronic neck pain. And this was a case just to highlight the benefits of ozone saunas. So we started Nima on a 10-week ozone protocol. And he got, after the first 6 treatments, he got upwards of an 80% improvement in his neck pain. And then this is Kim. Kim, I'm still working with, but Kim came in with a history of experiencing migraines, brutal migraines, in a pattern, a really predictable pattern over the 4 years prior to coming to the clinic. And Kim is an example of someone that responded extremely well to IV nutrient therapy. So Kim started some IV magnesium, and literally her migraines disappeared within the first couple treatments, and she's still maintaining this benefit. Kim had an exceptional response, and not everyone responds this quickly to IVs, but for Kim and for her migraines, IV was the solution that she was looking for. So let's dive into what functional medicine is briefly. We're going to go through this pretty quickly because it's not as core to what we're going to get into tonight. But I want to highlight that really what we're doing here at the clinic is the medicine of why. Functional medicine and naturopathic medicine is the medicine of why. Conventionally, the physicians are profoundly skilled at identifying the what and diagnosing, right? And so I think what we need more of in the world at large, right, are practitioners that are excavating the why that underlies rather the what. So this is really where my head is at as I'm connecting with someone. Also, sort of underlying philosophically what we're doing here, we're looking at a person as an integrated system, right? We're not isolated organs walking around the world. We're not hearts and livers and kidneys and brains and bowels walking around the world isolated from the others. So if we look, as an example, at a pain patient, if you are a pain patient and you're sort of walking down the conventional path, you are seeing either just your GP, right? Or you're seeing a rheumatologist, someone that specializes in your joints. If you're a pain patient, and walking down a naturopathic or a functional medicine path, you are talking to a practitioner that is looking at you from a joint and a gut and an immune and a psychological and a hormone perspective all in one. Because if we know anything about the human frame, it's that these systems are constantly interacting, right? I think the most obvious example, right, is how the gut influences the brain, right? Or the relationship between gastroenterology and psychology. But the same exists between psychology and rheumatology, or gastroenterology and rheumatology. There's an interdisciplinary approach that needs to be taken here. And this is really what sets a functional medicine practitioner apart. And humor me with sort of one more example, because I think this drives home an important point. Let's use this anxiety example to highlight that one more time. If we're an anxiety patient and we go to our family physician, we are being prescribed usually an anxiolytic or a benzodiazepine. We're being prescribed a pharmaceutical approach to dealing with that symptoms. And sometimes this is incredibly important. But sometimes the body is asking for more. And I like to challenge people by showing this example. The anxiety for in this case could be coming from a B12 deficiency, right? Because this patient that we connected with has been on an acid blocker for the last 10 years. So the anxiety is because they're low on B12, not because they're deficient on Zopiclone or some benzodiazepine, right? Or maybe they've been consuming fish every day, 3 times per day for the last year, and they're mercury toxic, and the mercury is driving the anxiety. Or they're hypoglycemic, and the panic attacks and the anxiety are coming from low blood sugar. Or they had a leak in their basement, right? And this happened in their last year, and now they're breathing in mold spores, and that's driving the anxiety. So I think you understand what I'm getting at here, right? If we're not looking at the root cause, we're missing an opportunity, right, to support the reason why that patient is feeling the way they are. This is just a page quickly to highlight this idea that it's so important to always be looking at the forest for the trees, right? We need to, when we're connecting in our health work, we need to be viewed from the perspective of our entire lifeline, right? What's happened to our bodies from conception, and sometimes before, but from conception to today. And this is just an example of a gut case that we saw. They came in, inquiring about gas and bloating. They had IBS-like symptoms. And as you go back in their timeline, you learn all this information, right? That predisposed the onset of the age 44 symptoms. So that's equally important with a pain scenario. And finally, before we get into root cause, everyone, I want you to burn this image into your mind, because if there's any point that I make tonight, I think this is probably the most important. If you are going to succeed in your pain work or in your healing work at large, it needs to be as comprehensive and holistic as possible. So this is an arthritis pie graph, is what I call it. And each segment denotes a different chief concern, or I'm sorry, a different root cause. So what I've said here is vitamin D is contributing to this person's arthritis, heavy metals, Epstein-Barr, which is mono, gluten, intestinal permeability, and stress. So what I'm seeing time and time again with cases that are unsuccessful in their pain work is they're only looking at a portion of their pie graph. Okay, they're only looking at vitamin D and stress as an example. And as you can see, that's going to bite off maybe 33.33% of their pain. Or they're looking at gut and metals, and maybe they're getting a 60% improvement. You are only reaching 100% improvement when you have identified and resolved 100% of your factors. So the question tonight for everyone, right, is what does your pie graph look like? All right, let's get into the meat. So these are the 7 things that we're going to cruise through, highlighting the main drivers of pain. Intestinal permeability, we're going to look at foods and a term called molecular mimicry, infections, metals, glyphosate, stress, and then we'll talk very briefly about one of my favorite topics in the last year or so, which is water and dehydration and how that plays into joint pain and muscle pain. All right, so the very first thing we have to talk about if you are dealing with a pain story is something called intestinal permeability or leaky gut. Um, I promise, if you have pain, you have some degree of intestinal permeability, and this is why I start with this one as the jump off point, because 100% of the people that I see have this diagnosis or subdiagnosis. And all this is, so this is a cross section. What you'll see here is a cross section of the lining of the gut, right? This is the small intestine. This is a cross section of that lining of the small intestine. It's 1 cell thick. So just to put that into perspective, in terms of the fragility of this area, it's 1/7 the diameter of a human hair. 1/7 the diameter of a human hair is this one layer of cells that protects your blood here, or your immune system, put another way, and all the things going on in your colon, right? The toxicity, the infections, the undigested food proteins. When you have damage to these cells and you get this pathway and this admission of these toxins, infections, or foods leaking into the blood, that's when the immune system starts to react. So the inflammation initiates in the intestine, gets into the blood, and then can propagate to the next area that's most compromised, whether that's knees, shoulders, head, neck, back, hips, whatever it is. But if you learn anything tonight, or take home again anything tonight, it's that the process is starting because there was a compromised permeability in the lining of the gut. What's causing this? This is certainly a talk for another night, but here are 6 or 7 things: poor diet, dairy, gluten, sugar, processed foods, low fiber. Smoking has been shown to break open intestinal permeability. Certain medications like non-steroidal anti-inflammatories, okay, alcohol, stress, and so on. Um, this handful of factors will drive open, these junctions in the lining of the gut and allow access to the blood. Now, I want to point out, because obviously this is a pain talk, there may be people on the call tonight that have tried an NSAID med, or like Advil or aspirin or Aleve or Celebrex. These pain meds, although helping symptomatically, right, are actually contributing to the problem, because unfortunately they're driving this permeability concern. And then below that, obviously some non-pain related meds, but antibiotics, oral contraceptives. A lot of women don't know that birth control pills are constantly irritating the microbiome and constantly irritating this intestinal permeability. Some chemo drugs, and then stomach acid meds or proton pump inhibitors. If you've been on a proton pump inhibitor, I can guarantee there's some degree of permeability that exists there. So as you excavate root cause, you have to look at the obstacles here. What's getting in the way of healthy gut function? How do we test for this at the clinic? Well, we use this GI map. This is the test that Steve did. Not only does it include a parasitology, but it includes this zonulin measure, and that tells us how advanced the leaky gut is. All right, so the next most important cause for chronic pain is a term called molecular mimicry. And essentially, this is just another term for autoimmunity, actually. So this is just an antibody response that instead of reacting against an infection, which it's designed to, actually starts to react against self. So that could be joints, like rheumatoid arthritis. It could be the brain, like MS. It could be the gut, like Crohn's or colitis. But there's a series of events that happen there that allow the body to start to attack itself. And I think a good example to think about with this is there's got to be people on the call tonight that have been prescribed an antibiotic after they've gone to the dentist. Right? They've got some dental work done. They've been given an antibiotic, and the reason for that is because the strep infection that can form in the mouth that they're giving the antibiotic for, the antibodies can actually cross-react with the heart. So they give the antibiotic to kill the strep, so the antibodies don't cause rheumatic heart disease. So that's a well-known relationship there. Type 1 diabetes is an antibody response, right, against the pancreas. So what's most relevant in terms of this topic for pain is this relationship between gluten and molecular mimicry. So the same mistake, right, that the body's making against strep can also happen with gluten. So the immune system makes an antibody against gluten, but then that antibody mistakenly tags one of our tissues. You know, this slide that's up right now is actually a slide that's showing the process that's involved with MS or multiple sclerosis. So those gluten antibodies end up tagging the brain, the area of the brain that's involved with MS, and then the immune system ravages that area, the myelin sheath. But the same thing can happen. These antibodies against gluten can tag our articular cartilage. And so the immune system starts ravaging the knee joint or ravaging the spine because it's trying to get at, it thinks it needs to attack this gluten antibody. So how do we test this? We do an IgG food sensitivity panel. So this tells us how reactive or how responsive our immune system is against a whole host of different foods. All right, so everyone will remember Steve's story from earlier and his sort of recovery after treating and resolving the parasite. Well, the point that I want to make in this next section is there's a whole host of different infections that have been found in research to contribute to rheumatoid arthritis and osteoarthritis. Viruses, retroviruses, bacteria, mold, and funguses have all been associated with joint pain. I've just handpicked a few to drive this point home. This was a paper that was published in an NIH newsletter recently. This is gut microbiome linked to rheumatoid arthritis paper, and what they're finding here is specifically a bacteria called Prevotella Bacteria was found in 75% of all rheumatoid arthritis patients, compared to 20% or 21% of the control. So a group of arthritis patients and a group of healthy patients. And in that group of arthritis patients, 75% of those people were found to have this pathogenic bacteria called Prevotella. 21% found in the healthy population. And the same sort of relationship has been found in yeast. These are two studies that found a stark relationship between Candida albicans and arthritis. So I'm not going to get into any more detail. I don't think we need to spend time there, but this is just to say things like bacteria, parasites, and yeast are often at the heart and often why a pain story remains unresolved, because it just hasn't been looked at yet, right? It just hasn't been, the diagnostics haven't been offered to the patients to uncover this information. So these are just a listing of some other papers that found the relationship between these infections and pain. All right, So that was 1, 2, 3. Now into the fourth main driver of pain, we have to talk about heavy metals for a moment. This is often a really important and an undiagnosed factor for a lot of people. This study that's up right now was a study out of India, a huge study actually out of India, that showed cadmium, lead, and mercury levels in rheumatoid arthritis patients was through the roof compared to controls. So this is telling us that in some way, these factors, these toxins, are driving this arthritis picture that we're seeing so much of. Where are these coming from? Well, unfortunately, they're coming from everywhere. Electronics, older paints, municipal water systems, dental amalgams. Obviously, if people still have silver fillings in their mouths, mercury is still off-gassing. Lipsticks and different cosmetics have been found to have some lead levels in. It's shocking the places that these metals are coming from. So essentially, yeah, it's coming from industry or agriculture. It's getting into our water, which is getting into our food, right? And then which is getting into us. But probably more importantly than where it's coming from is how it's affecting joints specifically. And this is the take-home slide for heavy metals. But if our body is burdened with something like mercury, as an example, what mercury is doing is it's stealing sulfur from the articular cartilage. And sulfur plays an incredibly important role in the regenerative process of connective tissue. So this is a knee here on the right. This white is the articular cartilage. This is essentially just padding so we don't get bone on bone. This is the femur. This is the tibia. So what sulfur is doing is it's helping things like glucosamine and chondroitin and hyaluronic acid heal the damage that incurs day after day to this cartilage. So this is damaged cartilage. Sulfur will come in and it'll fill up these holes, fill up these holes, fill up these holes. But what metal is doing is it's stealing sulfur from these compounds and preventing this regenerative process. So this is more about why we're not healing fast enough, right? Metals are getting in the way of that healing response. How do we test for these metals? We do a urine toxic screen. So if we suspect based on exposure or your job over the last 30 years or your dental history that you may be high in one of these metals, we can run a very simple urine toxic screen. This is a 6-hour urine collection that gives us information about the burden of these important metals. All right, and no chronic disease story, and certainly no pain story is complete without a investigation into how glyphosate may be playing a role in that. So for those of you that don't know, although I'm sure all of you do, glyphosate is the main ingredient in Roundup. And it is probably the single most important change in our environment over these last 30 years. Yes, other things have changed. Yes, the environment has become more toxic as a whole. But there's no doubt in my mind that glyphosate is the thing, the chemical that's creating the largest burden on the human frame out of all of them. So rates of glyphosate in humans have skyrocketed by 500% between 93 and 2016. So 500% increase of glyphosate in human urine over those 2.5 decades. High levels of glyphosate have been recorded in 70% of all oat-based breakfast. Why oats? Well, oats are heavily sprayed with glyphosate. 6 out of 6 popular brands of orange juice riddled with glyphosate. You get my point here. Glyphosate is everywhere, and there's no way that any of us are moving through a day without increasing our burden. It's virtually impossible to get through a day without adding to our glyphosate burden. whether it's in the air or whether it's in the water that we're drinking or in the food that we're eating. So how is glyphosate contributing to this epidemic in chronic pain? Well, what it's doing in our food is it's depleting a really important mineral called manganese. And just like the previous slide was showing the relationship between sulfur and articular cartilage health, manganese plays an equally important role to the health of our articular cartilage. So without manganese, it's much more likely that we're going to get bone on bone in the hip or bone on the knee. The other thing that glyphosate is doing, in addition to compromising the cartilage, is it's actually acting like a potent antibiotic. So it's going back to that very first slide in the leaky gut section. It's profoundly contributing to this leaky gut picture that we're seeing. We'll quickly go through here, everyone, the next 6 slides. These are graphs that were put together by an MIT scientist, Stephanie Seneff, who I have turned to for all my glyphosate information, essentially. I would consider her a world expert in the topic, but she has created these association graphs between glyphosate spraying and different chronic diseases. And at the bottom of these graphs, I've left the paper. So if you want to screenshot any of them, or we'll be happy to mail out these slides when we're done, that you can reference these again. But this graph in front of us right now is the relationship or the association between glyphosate spraying and thyroid cancer. So glyphosate, the amount or the volume of glyphosate is in the red year over year, starting in '89. And then the death rate due to thyroid cancer is in the yellow. So again, these are not causation, these are just association. This is diabetes in yellow, glyphosate in red. And then we have celiac disease, yellow, glyphosate on wheat specifically in black. And then this is dementia in yellow, glyphosate in red again. This is autism from 91. Matches exactly the incremental increase in glyphosate sprayed. And then Alzheimer's. This is the paper that cites this information. If you guys want to read through this is a really actually interesting read as far as scientific papers go. So let's jump back into the pain relationship with glyphosate again for a moment. I wanted to just highlight again how exactly it's depleting manganese in our bodies, because it's not depleting manganese in our bodies directly. What glyphosate is doing, as shown in this graph, is it's depleting these important minerals in our food. Okay, so this is a plant, let's call it corn, that has not been sprayed with glyphosate. This is corn that has been sprayed with glyphosate, and then this is the iron uptake of those two species. Okay, so this is manganese here. So the corn that has not been sprayed with glyphosate is bringing up healthy amounts of iron, healthy amounts of manganese, and healthy amounts of zinc. The corn that has been sprayed with glyphosate is not, especially with manganese, right? And so essentially what this is doing is it's creating an epidemic of mineral deplete plants for us to consume as a species. And so year after year, we're just getting lower and lower in these important minerals that are so protective in the pain story. And like I said earlier, glyphosate is also acting, right, as this antibiotic. Imagine what your body goes through when it's on a 7-day antibiotic, right? I think everyone's had a negative experience with an antibiotic before, or a month of antibiotics. Imagine what happens with the gut there, right? The diarrhea, the bloating, the gas, the yeast. But think of this, every day in microdoses, you are consuming an antibiotic in the form of glyphosate. So every day It's like you're taking an antibiotic for strep throat or an antibiotic for a UTI. That's wiping out and ravaging the diversity of your microbiome. One of the questions that patients will often ask, and I want to touch on this for a moment, is why has there been such an increase in the amount of celiac or non-celiac gluten sensitivity over the last 3 decades? And the best answer that I have for that is in front of you right now. It's entirely to do with the glyphosate spraying. There's a direct relationship between the incidence of celiac and the incidence of non-celiac gluten sensitivity and the amount or volume of glyphosate sprayed year over year. And the way that this is happening is actually through the presentation of a receptor in the lining of the gut. So gluten is a protein in wheat, right? That is only harmful to a body, is only harmful to a body if it makes its way into the blood. So I know it's hard to see on this graph, but this little diamond is supposed to represent gliadin, or think of this as gluten. And the only way that gluten is getting into the lining of the gut, through the lining of the gut and into the bloodstream is if there's a receptor cell there for that gluten or for that gliadin. And the thing that is presenting the receptor cell to bring in gluten to the blood is glyphosate. So this has been fascinating research by the lab of Zach Bush. He's an MD in the States who I look up to and follow. And his lab has shown this relationship between the ingestion of glyphosate and then the presentation of these receptors that bring gluten in. So you're only gluten sensitive if you're glyphosate toxic. Okay, you're only gluten sensitive if you're glyphosate toxic. And this is just an interesting chart of foods that are really high in glyphosate. Cheerios, top of the list. Honey Nut Cheerios right below. If you do anything in terms of take homes after tonight, just stop eating Cheerios. Trix, Annie's, gluten-free bunny cookies, cornflakes, Kashi's, I think this is a cereal bar, Frosted Flakes. This is on the right, a Canadian study. So it's like I was saying earlier, it's very, very hard to avoid glyphosate. But if there's any rationale for an organic diet, this is it. And outside of pain, I want to touch on this too, because this is important. I know we're dragging this glyphosate section on a little bit, but just stick with me here. The other thing that glyphosate is doing to our plants is they're blocking the production of really important building blocks to the human frame: tryptophan, phenylalanine, and tyrosine. Think of your body as just a collection of protein, right? The eyes, the lining of the gut, the liver, the brain, it's all just protein. And the building blocks for those proteins are these essential and non-essential amino acids. But what glyphosate is doing is it's blocking our food's ability to produce those building blocks. So I think the analogy that I like here, imagine trying to write a sentence without vowels, right? Imagine trying to write a sentence without vowels. There's no way you could do it. The same is true of our bodies and these amino acids, right? There's no way we can build healthy gut lining. We can build healthy teeth. We can build healthy eyes without these important building blocks. And glyphosate is blocking these. So if you have a thyroid condition, you're overly stressed, you're dealing with mental health concerns, you have insomnia or depression, these amino acids, tyrosine, for example, which glyphosate is blocking in our food, is the building block for thyroid hormones. If you have hypothyroidism, this matters to you. If you are stressed or feel like tired and wired, Tyrosine is also the building block for your main stress hormones, epinephrine and norepinephrine. If you're dealing with mental health stuff, serotonin gets built from tryptophan. Melatonin gets built from serotonin. So if you're having problems with sleep or mood, the things that glyphosate are blocking in our food become a huge problem. So I just wanted to extend that out a little bit more broadly than just pain, but this is why I'm so passionate about trying to mitigate this glyphosate concern with patients. But if you have pain, you have to look at this piece. How do we test? It's a simple urine test. So it's really simple to quantify. All right, let's move on to number 6. We're almost there, everyone. You're doing well. I feel like I need to pump the energy up a little bit here. Let's we'll fly through these next 2, and then we'll get into a little bit about the pain program, and then we'll call it a night. I'm doing okay for time. We're at 50 minutes here. So the next section that you have to address in order to get to the end of your pain story is stress. There are 2 things that stress will cause in the body that contribute to pain: intestinal permeability, and they'll throw off a healthy cortisol curve. We'll leave out the first one, I think, out of the interest of time. I think everyone has a idea now of why intestinal permeability is so important to resolving pain. But I just will say that anytime we're in a fight or flight state or dealing with a perceived threat, all of the blood is moving away from the gut. All of the blood is moving into muscles. And that leaves a really compromised gut. It leaves a really compromised gut that is ripe for permeability. So we'll leave that there. Excuse me. But this is what I think is most important with pain work. I want everyone to take a moment and think about whether their own experience with cortisone is in their mind, or if they have like a story of someone else that has benefited from a cortisone shot. But cortisone shots are amazing pain solutions for people. If you've been in chronic pain, let's use a knee as an example, and you've got a cortisone shot, it's night and day. And the reason why cortisone works so well injected into a joint is because it's anti-inflammatory, right? But the one thing that people forget about cortisone is it's naturally produced by the body every single day. So the people that are getting into chronic pain scenarios are the people that are unable to elicit a strong enough cortisol response through the day. So this is a cortisol curve, it's called. And this is actually a curve over a longer period of time. And I've used this example for a stressor of loss of a job. So imagine you've lost your job and your body goes into this alarm state, right? What am I going to do now? How am I going to pay this bill? How am I going to pay my mortgage? What happens if my mortgage defaults? And so on and so on and so on. If that fight or flight state persists for long enough, right? It's not just a night or 2 of that perceived stress, it's weeks, if not months. Then we weaken this cortisol curve and we plummet out here at the end into this cortisol depletion state. And now all of a sudden we've lost our body's natural secretion of nature's most potent anti-inflammatory. And this is the point. At the end of this fight or flight cycle where inflammatory conditions will present themselves. So this is where we'll see an MS case pop up, or someone will be diagnosed with an autoimmune condition, or we'll get into chronic pain, because that pain is no longer being neutralized by these healthy spikes of cortisol. We've burnt out our cortisol. And this is really easy to measure in either urine or saliva. But you can track a 4-point cortisol curve throughout the day and see where you're leveling in the morning, where you're leveling through the day, and where you're leveling in the evening. All right. And last but not least, maybe my favorite topic right now in medicine is this idea of a state of water problem. So I am convinced that the large majority of people that are getting into concerns with chronic pain are having problems with this state of water. And what I mean there is that our water is actually existing in a fourth stage. I'm sure 5 minutes ago, if I would have asked you how many states can water exist in, you would have probably said three, right? Which is what I would have said 2 years ago. Water can exist in a liquid state, in a gas state, in a solid state, right? We learned this in grade 6 science. But this scientist, Gerald Pollack, who's up on the slide here, he has discovered that water actually exists in a fourth state. It's a gel-like state that has very unique properties to it. So it'll probably shock you to learn that all of the water that exists in your body right now, and you are 70% water, right, is in this fourth state. It is not in a liquid state. It's certainly not in a gas state. It's certainly not in a solid state, right? It's in this gel-like form. So every cell of your body is holding this gel-like water, and we are running into more exaggerated pain scenarios when that state of water, that fourth state of water, is compromised. And essentially, what is so characteristic of this water is that, yes, it's highly structured, right? As you see here on the right, this is regular water on the left. This is fourth phase water on the right. But most importantly, it's charged. Okay, so this water, unlike the regular H2O molecule, is actually carrying a net negative charge. And the point that I wanted to make tonight with that is that this is why it matters. If you can, for a moment, just imagine you're holding two magnets, the negative ends facing each other, and you're trying to push those magnets together, and you can't, right? There's repulsion forces between the like charges. You turn one pole and you make it positive, then obviously the negative and the positive stick, right? But if you're trying to go negative on negative, there's a natural repulsion there. And the same thing is happening in a joint. Okay, the same negative on negative repulsion is happening. Let's pretend that this is a knee here in front of you. So I haven't written it out here, but there's a net negative charge here on the top of this articular cartilage, and there's a net negative charge here on top of this articular cartilage, and they're repelling each other, and they're preventing bone on bone. So when you've got to this situation where you are getting this bone on bone, the reason why you've gotten bone on bone is because this net negative charge has been degraded. Something has compromised the intensity of that negative charge. All right. So yeah, I mean, here I'm just sort of pointing out that all the things that we've talked about up to this point, right? We've talked about leaky gut, we've talked about infections, we've talked about toxins like metals and glyphosate. All of these things are compromising our state of water, ultimately leaving this water less charged. So let's use 5 or 10 minutes here to just go over briefly this Beyond Pain program that we're offering here at FMU. This is the group of people that are offering the service, but essentially this is an 8 to 10 week collaboration between these phases and you to excavate all the factors that may be going on from a lifestyle perspective or an infection perspective or a toxicity perspective. But if I've learned anything over the years is that the people that are most successful in their healing work are the people that are taking as comprehensive an approach as possible. And that is best delivered by more than just one person. So the more the merrier. So this is just a quick timeline of what the Beyond Pain program will look like for a patient. it typically will start on a night like tonight, where you'll attend a workshop where we lay down some of the philosophy behind the work. The next step would be connecting with me for an intake. We'll go over your timeline. We'll go over your matrix. We'll figure out what your story is doing and how there have been some of these causative factors missed up to this point. Then you'll connect with our health coaches to get into the lifestyle component, the diet component, the sleeping component, the breathing component, to what's going on. You'll connect back with me where we go over some of your diagnostics, and then you're into the treatment. And let's talk about that for a moment. Some potential treatments. I'll bounce back to that in a second. So one of the things that we're using here to support people is IV therapy. So depending on what your diagnostics show, IV therapy might be super relevant to the work you're doing. If you remember, Kim was that migraine patient. She did IV magnesium with a lot of success. So IV is one potential stream for you. We're also using this treatment called ozone saunas, or ozone therapy is really supportive for an inflammation picture because of how it deals with mitochondrial dysfunction. We also use this in detox, in immune cases. Actually, this is out of curiosity, maybe I'll share this. This has been like a super successful COVID treatment for patients because of how it oxygenates tissue. And COVID is really just an oxygen deficiency condition. Pain, obviously, we're using this in cancer. And then just general stress and muscle tension, people respond really well to. We're also using injection therapy. So this is an injection technique called mistletoe injections, where we're using this plant extract to resolve inflammation, but also stimulate collagen in the joint. And if your pain is being driven by metal or glyphosate or a general toxicity picture, then we use molecular hydrogen treatments to support us. All right. Anne-Marie, do you want to jump in here and share a little bit more about the modules that you are working with people in?
Yeah. So hi, everyone. I'm Anne-Marie. I do the mind-body kind of one-on-ones throughout the program. So we have 3 hours together. And in those modules, in those one-on-ones, we're kind of filling out that pie graph like Dr. Ben showed at the beginning, where there's all these little pieces, and we want to make sure that we're hitting as many of them as possible. So in those lifestyle one-on-ones, we address diet. We go through a specific protocol there to look at intestinal permeability and working with that, looking at underlying food intolerances, as well as addressing the toxic load that's coming in through the diet. We look at sleep. How does sleep quality impact every other aspect of health and of yourself? And look at some strategies there of how to work with sleep. We talk about hydration, like Dr. Ben just went over, really diving into that structured water piece. And importantly, how do we structure that water in our cells? We talk about movement. We talk about EMFs, toxicity. It's just a really great place for us to really connect, to dive into the details of that pie graph, what other outlying factors are not being addressed, and dive into the work there. Yeah, it's a really great piece of the program that really addresses those overlooked pieces.
Yeah, totally. Thanks, Anne-Marie. Like, I think it just reminds me that this is why we've created the program, right? We've created the program so that we don't miss anything. So much, and I feel this every day in my work one-on-one with patients, is that I know that there's information that we're just not getting to. And so when you can approach your pain or your chief concern from a group perspective, right, delivered like this in a module format, it's no stone unturned. And there's a deep peace of mind that comes with knowing you're moving through your pain work as holistically and comprehensively as possible. And maybe I'll just share here too, that there are, a lot of people do have insurance that will cover a lot of the costs involved with this program. Anne-Marie is a nutritionist and has obviously licensing to back that up. That work is often covered. I'm a naturopathic doctor, so if you have a naturopathic inclusion in your benefits, then you can use that towards the program and the consults and our time as well. So it's usually not the entire cost of the program being covered, but the lion's share could be if you have both those areas on your private health plan. So yeah, just as a reminder about next steps again, if you are interested in pursuing some of this pain work, it would be scheduling an appointment, then it would be an intake with me, and then you would connect with Anne-Marie, and you'd be back with me for some diagnostics, and then straight into your personalized plan, whether that involves IV or detoxification, or more lifestyle work. Because we want to honor sort of the time commitment that people take in connecting in a workshop like this. If you are interested or have been a part of tonight's talk, your intake with me will be discounted to $199. So I think what we'll do is just if you are interested in connecting and call in, just mention to reception that you've been a part of the workshop, and they will make this note in your file and take it off your first invoice. Lovely. Thank you, everyone. Does anyone have any questions or comments? Did anything come through, Anne-Marie, or should we
Phone
leave
number.
it there?
The phone number, I'll add that in the chat box. Can you see the chat box?
Yes.
Or I can also say it out loud. It's 519-745-1600. And I've also added the booking link to the chat box there. And you'll receive both of those as a follow-up email as well. In a follow-up email, you'll have the contact information. I'll also pop in here the clinic's email in case you just wanted to reach out and had any questions or anything like that. Yeah.
And Anne-Marie, if you want to put mine to benjamin.snyder@gmail, people, if there's any sort of follow-ups, they can connect directly with me too. Happy to connect that way. Yeah. So I think we have recorded it tonight finally. So, if anyone's interested in going over this again, we're happy to send out the video link and as well as the slides. Awesome. All right. Thanks, everyone. Enjoy this Thursday night. And thank you.
Thank you.